We are now live. We are coming up on the top of the hour here. I want to thank all the students of Maryland for joining for the second time in 2 weeks. We had a phenomenal doctor on a couple weeks ago, Dr. Maria Oy, and now we have another awesome doctor, Dr. Luke Shin, another former alum of the University of Maryland, and another 2020 grad as well. So he's fairly new into his professional career. And for those who don't know me, my name is Miles Murphy. I am the Academic and Industry Relations Manager here at Aspen Dental Management. I work for Aspen Dental Management, the support organization that supports the over 800 offices nationwide. We are the built-in consultants and the built-in partners for all of our owners of those offices. Everything from an operations standpoint, to a marketing, to a finance, to a payroll, to a tech, real estate, everything that goes into owning your own office and owning your own business. We are the backbone for all of our doctors and all of our offices. So I do want to thank all of the students from Maryland for joining. I see them that they're coming in at the second. And I also want to point out that we do have a question and answer box on the bottom of your screen. So feel free to ask any live questions for Dr. Shin. He would be happy to answer all the questions that you guys have. I know that you guys also did submit some questions beforehand, so we will be circling back to some of those questions as well. So thank you for those. We had an awesome session a couple of weeks ago. We had some amazing questions and answers. So I want to keep that momentum going with Dr. Shin as well, because he has an awesome story to tell you guys. So without further ado, while he's drinking his coffee and staying warm in Maryland, I want to let Dr. Shin introduce himself, open up the floor, and then we'll dive into some of these questions. So thank you again, students. Thank you again, Dr. Shin, for joining. And let's get it rolling.
Hi, I'm Dr. Luke Shin. I graduated 2020 May during pandemic from Maryland. I'm pretty sure most of you know me or have worked with me before. So I know the struggles at Maryland Dental School, but I hope you guys are having fun. I had a background with implant prosthodontic clerkship during my 4th year in Maryland. I'm currently an associate dentist, but also I'm an interim lead dentist for Elkton office currently. So I'm in my hotel room, so I'm joining in from Elkton. So if you guys have any questions, feel free to ask.
Thank you, Dr. Shin, and also thank you for the commitment from taking this from your hotel room. I know you're trying to stay warm over there, so thank you for that. We actually have a question that just came in regarding starting salary and is it on production based? Without going into any numbers, if you can kind of just touch the surface on what the compensation structure looks like, that'll be awesome, Dr. Shin. If you can also go into a little bit in depth on what the associate looks like and what the MCD looks like as well. So feel free to kind of give your insight on that, because I know that you'll be soon transitioning to the MCD role. So I'm gonna open up the floor to you to answer that first question that came in.
Oh, so I don't know if you guys know what MCD means. MCD means Managing Clinical Director at one office. So if you're MCD, you're pretty much a lead doctor in one location. So you'll be like, cultivating, facilitating all the clinical care that comes through that one location. As an associate, you are expected to work one location, or you can also float between offices. Currently, I am covering most of the Baltimore offices, but we got one of my grad friend, Dr. Matt Yarmosky, also starting as an associate. So I don't have to go to like 6 to 7 different offices. I pretty much stay in one location, Towson, or sometimes I cover for other doctors. As an associate, there is a base pay. So there's a daily guarantee. So whether you're getting through your training, whatever you're doing that day, you get guaranteed daily pay. It's very difficult for an associate who's flowing between offices to get the production. There is a profit sharing as an associate too, but usually that's for the rural area. If you decide to be an associate in one location, you build your production, you can get more, but there is a daily guarantee. So like, it's pretty much similar to the pretty much any other associate out there for the practice. Dr. Gupta, who's the pretty much owner of most of these offices, sets the daily guarantee with you. As an MCD, which is managing clinical director, lead doctor, your profit sharing is pretty much like more than an associate, of course, because you're managing the whole office yourself. So each month you get a set budget, and then if you make more than the budget that is like set for that one location, you're the MCD there, you will get the cut of it. So there is daily guarantee plus the profit sharing production based.
Awesome. Thank you, Dr. Shin, and thank you for covering that, because that's a question that I receive from all of my students all the time. They're really, really interested on compensation structure and how that looks like here at Aspen Dental, because everywhere is different. And that actually ties into our next question that a student just submitted, is why Aspen over places like Heartland, Pacific Dental, or even private practice? I know that you signed with us fairly early in your D4 year. You were actually sold on Aspen Dental. So I think you'll be a perfect doctor to answer this question. So why did you choose Aspen Dental?
I chose Aspen Dental early on is because like I was looking for more exposure in my clinical practices, and I was not ready to go into the business aspect of dentistry. It's quite unfortunate that some dental schools do not cover a lot of business aspects that a lot occurs in the private practice. For me, I needed some sort of a time where I can be an associate, learn the business and like how it works. And I was looking into different options of DSOs. Yes, the dental support organizations, and then they have different reputations and different companies. For me, I wanted to find the owner. So the Aspen Dental is quite a little different because it is under Aspen Dental name, but then there is owner. So there is a set defined dentist owner that has ownership over those locations, including Dr. Gupta. I mean, he pretty much owns 1/3 of Aspen Dental locations. When I met him, he was very chill. He knew right away what kind of goal I have. And then I also show my clinical portfolios and work that I did. And I really clicked with him well. So like he knew that I was just trying to be an associate, trying to gain clinical experiences, as well as trying to get some ideas about how business works. There are other Maryland graduates. I was surprised to get the offer that night when I met him for interview. And then I told him I'm not going to accept the offer right away, on the spot, but I wanted to have some time to, think about it the whole day. And then I decided to accept the offer because first of all, I was not going to go into residency, AHD or GPR wise. I wanted to go straight into the work. And then for me, I was not considering, am I ready or not? I was just wanted to be in the environment where I will be supported by the major doctors, each doctor. So that's why I chose to go into Aspen Dental over the other DSOs, because I felt supported clinically and also being able to learn businesses.
Awesome. Thank you, Dr. Shin. We have a question just around your personal experience and when you wake up in the morning and you look at your future and what do you see? How long do you think you'll be working for Aspen? I know that you're pretty much on the fast track when it comes to career growth here at Aspen Dental. So I'm assuming that this question is quite a long time, or at least in the near future, this is where you think you're going to be. So I would like to hear from your perspective. How long do you think you'll be here at Aspen Dental?
I don't really know how long. I didn't really set that plan that I'm gonna be with this company 10, 20 years. I have no idea. This is my first year out of dental school. All I'm focusing right now, which I'm getting, is being an associate, learning from so many different doctors I get to work with and seeing a lot of patients. For me, I wanna up the speed of my procedures. I wanna be able to trim and plan, thinking of the patient's long-term care, and also what is the best for them. Critical thinking is also very important being an associate Aspen Dental, because there's so many new patients that we get to see in treatment plan. So I'm trying to still figure like short little things at this point. I will be at least completing my 1 year associateship, and I do have opportunities to be a lead doctor. I'm an interim lead doctor for a couple of months here at Elkton, so I am going to be learning more about business and how to run the staff and how to be able to, you know, go through each day managing the whole office myself. So for me, I want to get that more experience, and then, I will think about it. But at this point, like I indefinitely I'm going to be with this company. I just want to be like, taking each day at a time. I think that's best anybody can do. And then, and I have a lot of doctor mentors that I can always talk to. So for me, like I just want to like do the work and learn. That's it.
Awesome. Thank you, Dr. Shin. We have a question that came in regarding support. You mentioned that you receive a full range of support, especially being under Dr. Gupta's umbrella. So this is a question that just, do you think other doctors support you well? I'll kind of tailor this question regarding how they support you, especially when you came out of school at Maryland and you started in an associate role. You obviously had your lead dentist there, right there with you. You had your mentor, doctor. How did those doctors support you? What did that support process look like for you?
So from smaller range to bigger range, within Aspen Dental, I do have a full doctor team support from the company itself. So all of the doctors across the nations are on one chat, believe or not. So we can throw in any cases, clinical cases. We do have prosthodontists who gives us TC courses. We do have oral surgeons. We have endodontists. We have, orthodontists. Support from the Invisalign company. So we have all these doctors that I can reach at my fingertip. I can message them. I can, send them a Microsoft email and all that. And then within my direct contact with Maryland doctors, like I have a group chat as well. So we have about like 15 doctors on this. And then if I see something on the x-ray and I have a difficulty time treatment planning or going over the case, I will like write a short scripts and then they will be able to get back to me about suggestions and recommendations. So I have clinical support everywhere. Business wise, like I do have like my office managers and I have like managers of the area and region and territory. There are many of them who has experience on the business side of things. So if I am dealing with some sort of finance or insurance issues, then I will be able to contact them. Hey, I need to do something about this patient's case. Like, can you please help us to figure it out? And they will get on it. So that kind of two big aspects of support I'm looking for. So I feel very comfortable working because if anything happens, I have support I can ask.
Thank you, doctor. We're getting so many questions coming in. Thank you, all the students of Maryland. We're trying to get to all of them. You guys are asking some amazing questions. I want to get to one that came in regarding regarding your offer process. So I'm not sure if you received many offers, whether it was from other DSOs or like a private practice or whatever the case may be. But when you signed, like I said, you signed early in your D4 year. In some of those offers that you may have received, what were you really looking for? What were some of the logistics, some of the terms that you were looking for? And did you have to negotiate any terms, maybe for your current offer that you signed, or maybe some other offers that you received? What were some of the things that you made sure were mandatory for you when you started your professional career?
For me as an associate, I really wanted to have daily guarantee. I researched before in my D3 and D4 year, and I was talking to some other associates who went through this. Like, especially we are living in the Maryland state. Like, Maryland state is not considered rural. We are pretty saturated with the dental providers. So to have a little competitive pay and edge, I really was looking for the daily guarantee. So in private practice offers that I received 4 offers, and they had a different numbers of daily guarantee. However, their daily guarantee is not indefinite. they will finish in 3 months or 2 months, depends on how I do it. It will be all based on production, and then there will be like one or two doctors I work with. For me, as a new grad, I was not about that because, like, first of all, I wanted to get full 1 year without the pressure of production. Second of all, I really need the daily guarantee because, like, it's a safety net. Like, no matter what I do that day, like, I will make that goal. I mean, I do way more at this point than my daily guarantee production. Like, I'll be making like 3 or 4 times more than that. However, that being said, like, in order to get there, I need to know that my income is protected. So that was the first important thing for me. Like, I'm gonna work my hardest, but then I just wanted to make sure that my finances are taken care of. And second of all, I wanted to be able to kind of, not be, alone too much, if you know what I mean. Like, if I wanted to be able to reach out to many different doctors' opinions, I want to be able to do that. So when I received some offers, like, with my connections, I wanted to make sure that they're like, I'm not just confined in one area of dentistry. So I looked at everything, and then I realized that, for me to be Aspen associate at least 1 year is the best option because I get to work with so many different doctors. They have different philosophy in treatment planning and the procedures. And then, I have daily guarantee and I get training. So including like Invisalign Cs or implant Cs. Like, for example, like within 6 months, I think I earned like 40 something C credits just, being going through training, and I get paid during training. So that was a huge bonus for me. That's why I was like, okay, I'm just gonna continue with my previous offer and then, start working right away.
Great. Thank you, Dr. Shin. I want to kind of piggyback on that answer a little bit regarding the implant C. So what exactly was the process of getting implant certified, and was the course certification paid for? What did that look like for you?
So in Aspen Dental, there is a learning module called the Blueprints. That's usually for the doctors. So if you get on it as a new grad, like we have implant continuum. So they used to have it in person because of pandemic. Now they're everything online. So you just have to go to each module, which takes a while. Thus, it gives you a lot of C credits. There's a part 1, 2 that's usually for implant restorations, including crowns and dentures. And implant part 3 is surgical part. So the surgery part has to happen in person. So like for me, like I wanted to get at least 1 and 2 done. So I go on the Blueprint, and it's paid for. So, and I go there and complete my C courses, and I take my exam, and I pass it, and I get the credit. So it's very easy and straightforward, and I got that done. And then the Invisalign, like they will enroll you with the Invisalign training courses, so you can start being a provider of Invisalign. And they also have continuing support. So I'm currently enrolled in Invisalign Pro course. So I did my initial Invisalign classes and I passed it. So I was certified to start Invisalign. So I started 3 cases since I got my certification at Start Easy. And then I'm going to my pro course, so I will be able to kind of handle more difficult cases. And then there is orthodontist always supporting us. So that's amazing. So I had those 2 as an example of being able to get the C's done.
Thank you, Dr. Shin. I want to transition to your in-clinic experience a little bit. We have some awesome questions that just came in regarding your experience in clinic on a day-to-day basis. So this is a question that came in regarding when you were at the University of Maryland, you transitioned to your professional career as an associate dentist with Aspen Dental. What do you wish you did while you were in school to prepare for the fast-paced practice? I know when you're at Aspen Dental, you're treating a high volume of patients, a little bit more than when you're in D4 clinic. I see that you're smiling here because you know how true that is. So what do you wish, what's a piece of advice you can give to some of the students here on this session that they can kind of take with them to learn a little bit about when they transition professionally and they're helping patients?
So within UMB dental school, you probably maybe get up to see like 3 or 4 patients a day if you're lucky. With the pandemic, there is a reduced capacity. Like I'm all the way around because I'm friends with a lot of faculties. So my best advice I can give it to you is literally ask me or any other doctor that you want to work in the Aspen Dental, or rather that's a private practice. I would recommend you to shadow, because it's a very different environment. It's a lot more faster paced, but there is a flow. So I don't want you guys freaking out saying that they're like, oh my gosh, I lost so much time in pandemic. Like I barely get to see like 2 patients a day. How am I going to start working? So here's the thing I can tell you is that all of us did it at some point. Whether you do residency program, GPR, AGD, whether you go went straight to work, people will get up to the speed. Like also, we are not asking you guys as a new grad to like start like, seeing like 20 something patients a day. Like that's not going to happen. Like, and everybody knows that like there will be a training period for all the associates. So I had a little difficulty time for a month because like I was the only associate in entire Maryland state at the time. So I was asked to do a lot more because, like one associate entire state in like, 7 different offices, like that's, that can be a lot. But then now we have, 2 other associates. And then like, our even work, like it's really helping us. And I know that there will be more opportunity for new associates this year, at least in Maryland. So I think the best decision I ever made when before I graduated was literally shadowed. So I shadow Aspen Dental locations, I shadow private practice, to get the ideas about what is daily like, what is it daily life is like of like one doctor working in a one location. It is very doable. It takes some time. I don't want you to worry about that in dental school. Just do everything you can in dental school and then trying to shadow outside of dental school and, reach out, that's the best you can do.
Thank you, Dr. Shin, for that advice. I actually like how that transitions to our next question in clinic regarding treating patients, right? Do you feel like you're pressured to overtreat patients to meet daily production? What does that look like from your perspective? I know that's a common question that I get from students all the time regarding quote unquote goals or regarding overtreating. Just tell us how your experience is like for that.
I never felt like I have to overtreat. Like also like everybody ever as a you're becoming your own doctor and you're gonna have your own philosophy of how you treat and treatment plan. Um, I worked with like, maybe 7 and other 8 different dentists. Like they all treat the treatment plan all differently. Each Aspen Dental location is catered by the one doctor. And let me tell you, like, there is no company rule or corporate rule that says that every single doctor has to approach like this. There's nothing like that. Like, I'm working with currently I'm working with a lead doctor in Elkton. Like, her treatment plan is completely different from like other doctor in Towson, for example. Like, there is a different approach. But the bottom line is, like, these patients are taken care of. Like what I learned in Maryland, like in dental school, they're all translating into my clinical life. So that's the important thing for me was that they're like what I learned in dental school, what are the fundamentals of treatment plan and how I start my procedure and then finish my procedure, they're all translated into the clinical practice that I do. And how I treatment plan, it's up to me and the patient. So patient's needs and wants, and I will consider that. I will have open conversation with them. This is not a company that is like, considered as like, dentistry factory. Like it really depends on who you work with. I even met patients coming to see me in Aspen Dental because they felt like they're overhyped to get a bunch of crowns and veneers done when they really don't need it in private practice. So like, it really depends. Like, I mean, no matter where you go, like, but then, you just have to stick to your gut. And I do that every day. And then I have no problem working here.
Thank you, Dr. Shin, for that insight. That's awesome. So question regarding the volume of patients you see in a day, how many do you think, give or take, would be that number for how many patients you see? do you have an assistant helping you? So what does your support system look like in your office? And that kind of ties, I want to kind of tie that to another question that we got in regarding the support and regarding the staff. So if you can kind of just give us what your staff looks like in your office, and how do they help with the amount of patients that you see per day?
So pretty much like brand new office, like I'm just gonna just set it up as like you're an associate dentist. Everybody starts as an associate, right? From here. So as an associate dentist, you will have maybe 2 to 4 dental assistants in clinic, and there will be a lead doctor, and there is a lab tech. We actually have each dental office, we have a lab technician. So they usually work with denture related issues or making dentures, like making flippers and everything. So that's another thing about is I get to learn from them as much as I learn from each, like, other DAs. So if there are seasoned DAs in the office and you're an associate, like you will be able to kind of like, get all the time like with the DA. So as an associate, we get a 1 column with a production, and another half column, which I share the column with the lead doctor, treatment planning with the new patients, or I will jump into the post-op if I did surgery before. So like maybe as an associate, it would be like 1.5 or 2 columns you get to do. And you have a DA, so dental assistants will be there pretty much every day. Sometimes we get short staff, sometimes we have boring days, but that's usually how life works, right? So you get to do that consistently, and then you get the flow of it. So as a lead doctor, like, they will always have 2, 3 DAs, and then you will be managing like 2 to 4 columns. And then you will also do hygiene check. So there is a hygienist as well. So like you get to work in that kind of environment. And then as an associate, I really think that I had, assistant all the time. Like unless the assistant called in sick, then I have to share an associate with the assistant with a lead doctor. But I get through my procedures just fine. I didn't really have any issues. So like that's how like usually like each location looks like as an associate doctor.
Great, thank you, Doctor. So I'm gonna bunch up these 2 questions because they came in one after another. There's a first part and then a second part. So, is there ownership opportunity at Aspen? Um, and would you ever consider that? I know that we kind of touched base on your future a little bit, and you kind of given your experience on starting off as an associate, working towards a lead dentist. So, all the students would like to know is, would you ever want to own with Aspen Dental? Have you ever thought about it? Especially working with Dr. Gupta, and I think he might have the most offices in the whole organization, or he's getting there at least. So what is he at? Maybe north of 30 at this point. So would you ever consider owning at Aspen Dental? Have you, Doctor?
So, Aspen Dental has been evolving a lot with the, opportunities for ownership because, before Dr. Gupta, actually you have no term called partners. So there's a partner ownership at this point because when Dr. Gupta was taking over 30 offices, he realized he cannot be managing 30 offices by himself. So he decided to include some dentists who are lead doctors to take over as a partner owner. So partnership is actually not like, common, even in private practice. But for me, I ultimately wants to get to the level where I just want to be working as a lead doctor. And later when the time is right, and then there is opportunity to be a partner in the location I like. Yeah, if Dr. Gupta asked me to be a partner, yes, I would definitely do that. Or if Aspen Dental is opening new offices, they're looking for an owner to be the actual owner, not with the partner with anybody else, but you want to be owner of new offices. They also have that opportunity. I don't think I'm there yet. So I just want to like, learn more because, partners and ownership, like that's a different type of business. So I mean, there is a support for them to go through all that transition, like how to be a partner, how to be an owner, how it works for you to get that profit sharing that you desire, and how to really hire people and manage the staff. it's a different story. But like it is possibly there. And then I think, if I'm thinking next 5 years, that would be a good opportunity for me to jump on, at least a partnership owner.
Great, thank you, Doctor. I want to transition to a question regarding, I know that we talked about your offer and the letter of agreement. What do your benefits look like? Were there any benefits that you made sure were mandatory when you were signing? What are some of your, we spoke about compensation. What are some of the benefits that come with that?
So I wanted to get most of my C's covered, which is like covered. So all of my Maryland state mandatory C's are paid for, so I don't have to worry about that for my license. And I wanted to get a healthcare benefits, because I think that I wanted to make sure that it comes with a reduced discount or reduced pricing. It comes directly out of my check, so but then I don't have to pay like crazy amount of private uh, you know, healthcare insurance. And then, I get full dental, vision, I'm not too worried about the vision. But, there are other benefits, including like retirements and stuff. Oh, they do 401k matching. I don't know if people are thinking about that ahead. But there is a matching opportunity, which is pretty much significant. It's like 2% of your annual income that will match. So you get additional of that. And then C is pretty much, I mean, just at least two, healthcare and C's. I just want them to be paid. I don't want to pay out of my pocket, but they're paid. So yeah.
Great, thank you, Doctor. We have a question. Let's stick on that the offer kind of topic here. Is your contract yearly, or if so, do you start renegotiating for the next contract? I'll go ahead and jump in and say we don't have any contracts here at Aspen Dental. They're called letter of agreements. So if you want to kind of touch upon what a letter of agreement is and what's the timeline look like for that? I can answer it. You can answer it. It's completely up to you. Go ahead.
So letter of agreement is something that you get within a day that you receive offer from the owner. So the owner and then the company, they have to agree to hire you. So it's not a recruiter, it's not anybody else. Like for example, for Maryland, Pennsylvania offices, it has to come from Dr. Gupta. He's the one that makes a final offer. If the offer has been made and then you decide to go for it, you sign the letter of agreement, you send it back to them, and they will start your background check and they will start your credentialing and everything to make sure you're licensed to work in the location that you're hired for. Yeah, that's pretty much how it works. And then I don't think that I had to negotiate like a lot, because it's not a contract. It's like just agreement that I will start working for you from this day moving forward. I don't think I have end day on my agreement. So like pretty much like it's like faith based, I would say, which is like kind of crazy to me because like you're hiring a dentist. Also, it depends on the owner doctor that's hiring you. Dr. Gupta's letter of agreement was very straightforward, simple. It was like only 2 pages long. It was not a crazy long contract or letter of agreement. It was just nothing like that. I don't think I even have non-compete. So I don't know if people know, when you sign a contract with a private practice and then they give you non-compete, means that they're like, you cannot practice dentistry within 5 or 10 miles of the practice you worked in. So let's say you are working in like, Crofton in Maryland, and then you cannot work in that town because it's a non-compete that you sign after you leave your job. There will be like non-compete effect in like next 2-3 years. So I don't even have that. So I can pretty much like go anywhere within Maryland or Pennsylvania to work, even if I decide to like, not continue working for Aspen Dental. There is no pressure for me. So I like that too, because like, gives you opportunity, like, do you want to work for it or not at this point? You got the offer, you deserve to work here. It's up to you. So it kind of asking you as a single dentist, like it's up to you to make that commitment.
Great, thank you, Dr. Shin. We have a question regarding Dr. Gupta's information. How many offices does Dr. Gupta have, and what is his full name? His name is Shikar Gupta, and I believe he has a little bit more than 30 at this point. It's always growing. His network is always growing. So maybe you have the exact answer to that. If you don't worry. I know that it's north of 30, and should be a lot more by the end of this year. He's in PA and Maryland. So he's like a big name and doctor and staple in our Aspen Dental organization, and he's amazing. Dr. Shin, if you want to kind of give your insight regarding him. But there's a question that kind of ties to that as well. So let's get into Dr. Gupta as a mentor. Do you think you would have chosen Aspen if he wasn't there as a mentor?
Uh, Probably. I mean, I think that what made a huge difference for me was that he really wanted to see me grow as a doctor, as a person. Like for example, like, I had dinner with him, with his territory manager. It's like territory manager is like his right hand man, that he travels with. A couple weeks ago, he take me out to this fancy hotel, and like, you can get whatever you want. It's cost him like $200. I was like, okay, I guess you're paying for me, so I'm just gonna choose whatever I want. So like he does like care about each doctor he works in. Like even today I was in Elkton, he just, before snowstorm hit, he just wanted to come see me. Like he wanted to come see the lead doctor that I'm taking over for, but he wanted to come see me, is like making sure that I'm doing okay. Because like he knows that it can be a lot of pressure for a new doctor to be all this stuff. But then I was like, thank you so much. I mean, I was not expecting to see you, but he will randomly pop up, check on you, and then making sure if you have any questions, like you can message him. Like we have doctors chat, he will like answer all that, like asking me what I should do, what you think I should do. So he's always there for me. So that's what I really appreciate, the fact that he trying to connect me with the other doctors, and that he's answering all of my questions. Like, you think that guy who owns like, I think he's about to own more than 40, let me tell you that, with after this year. So you think that he has like literally no mental capacity to care about his associate. He really cares about his associates. Like he has more than 10 associates in different areas. So he really cares about each doctor that he hires, and it's good to have a good relationship with him.
That's awesome. And I love that you touched upon the support that he gives you regarding how many offices he owns, because I remember when we first connected and I knew that he owns so many offices in the Aspen Dental organization. And I asked you, like, do you ever see the guy, right? Like, do you ever see him, because he owns so many, he's probably traveling and kind of overseeing some of those offices. But it's great that he still provides you that full range of support, even though he owns so many offices. And I love that you touched upon that he cares about his associates, because I absolutely believe it, and I hear it all the time. So I love this question that came in. This is an awesome question, and I want to hear the answer to this. From a scale of 1 to 10, 10 being the best standing, where do you think you stand if you compare yourself to other new grads? I want to really hear this from you. I want to see how you rate yourself as a doctor, still being licensed fairly new, right? Like you graduated less than a year ago, right? You got licensed less than a year ago. So how comfortable do you feel as one of the newer doctors, or what would you rate yourself? Like, what's your perspective and insight on that?
Well, I think I will be like in the middle, like 5. Like, I don't think that there is a way to gauge one doctor or one new grad dentist as like the best among them. Like, because it really depends on how you treatment plan. It really depends on how you do procedures. If you're thinking about like, speed, my speed is like increasing every week because I'm doing so much procedures like every week. So like each thing that I'm doing, like, I'm going faster, but then, but I don't think that really matters, because like, what matters at the end is that how is my product for the patient, like whether that's extraction, whether that's a bone graft, whether that's endodontic care, whether that's fillings or dentures, like I did what I could do, like that's how I see myself, is that they're like I don't think that I will be putting my like self on top of other people. I just think that I'm doing everything I can each day for the patient I see. I mean, granted, there are many patients, and granted, I will be making some like slow like mistakes or whatever that I do, or I say something wrong that rubs the patient's wrong way. I mean, we're all humans. So I think that myself seeing that the things that I do now, like I'm still learning. So I don't think I'll ever get to 10. Because like, like, in dentistry, like there's no 100%, perfection. I mean, we chase perfection for the patients, but the way we do things is just kind of like you'll always be room for improvement. So that's how I see it. Like, yeah.
Thank you, doctor. I think you'll get to a 10 at some point. Thank you for being modest. You're an awesome, phenomenal doctor. And it's great to see your progress from when you graduated to now, and when you transition to the future. So that was an awesome question. I wanna, we had a question that came in regarding shadowing at Aspen as a fourth year student. I can go ahead and start this question. Dr. Shin, if you want to go ahead and piggyback on my answer a little bit, but you can absolutely shadow as a fourth year student. When you decide where you want to go, we partner you with the director in that territory. We partner you with that owner doctor, whether it's Dr. Gupta or whether it's another owner doctor in our network. And we give you the opportunity to shadow an office. And it's great to shadow an office just to kind of see how the office works, how some of the system works, what the teamwork in that office looks like, what the support looks like in that office, what the patient flow looks like, everything that kind of ties into being in that office from an everyday basis and an everyday perspective. It gives you the opportunity to kind of do that and kind of get acclimated and kind of get your feet wet a little bit as a student. And it also helps you make your decision as well, whether that's the office for you, whether it's not the office for you, whatever the case may be, and whatever how you feel. That it's good to kind of get that going. So, Dr. Shin, if you want to kind of touch upon what your shadow process looked like, and how did that help you make your decision?
Well, I received my offer like in 2019 December. That was like 6 months before I graduated. I shadowed one office, Towson office, before that, and then before I graduate, I realized I want to see other offices. So like I will contact like Dr. Gupta or some other people like, hey, I want to come to see this office, and they were trying to like connect with office manager and territory manager to make sure that, okay, this future doctor, someone is coming to shadow this doctor, which day is perfect for them, or because we do have a very crazy day. Sometimes an oral surgeon is in the house and we're seeing like 40 patients that day. Sometimes like there's literally no room for someone to come in, they will tell you. So I went in when it was like moderately busy, and then they had all the PPEs, so I did not worry. I didn't have to worry about that. And then you can bring your own N95. You can bring your whatever PPE you want to wear, and then you just pretty much like shadow the doctor or go back to see other people in the office. Like it really puts you into the perspective. And one thing I will tell you though is that if you decide to shadow one office, let's say you go to Towson office, and that's not the literal copy of every single other Aspen Dental location. Like I was saying, every Aspen Dental location is like different private practice. So they all have different scheduling. They have a different like ways of doing things. So I think if you just have to shadow, don't take it as a like this is exactly how Aspen Dental works. That's not. It really is not. So just get that experience and like maybe go to other different offices. I mean, I know that Maryland dental students are vaccinated, so I'm not too worried about the COVID-19 tracking. But make sure that they're like you're practicing yourself, social distance and everything before you come shadow. So there are many opportunities in Maryland.
Great, thank you, doctor. So I want to transition to this question because I know it's a question that's really, really important to a lot of the students And we have so many questions coming in. We have 28 questions that came in on this session alone. I want to thank all the students for asking these awesome questions. I want to transition to location for you. To my knowledge, I know that you did want to stay in Maryland, but you also mentioned that Maryland is kind of a saturated area, right? It's a saturated area for doctors. Um, and what did location mean to you? Were you willing to kind of step outside of Maryland? Were you kind of all in and all set on Maryland? You were one of the lucky doctors to come into Maryland as an associate. So what did location mean to you when you were making your decision?
So I know that Dr. Gupta had Pennsylvania, Maryland location. He was, suggesting Pennsylvania, and then I was like, well, the thing is, though, you do have Maryland location, so maybe I can just be an associate for those. And he was like, fine. And then I decided to stay in Maryland. So in Maryland, we have Towson, Elkton, which is near Delaware. We have Salisbury and Berlin, which is near Ocean City. We have Glen Burnie, Hillthorpe. We have now Westminster. We have Owings Mills. We have Abingdon. There are many different locations out there. For me, coming into kind of like start associating through these offices, like I felt very lucky. And I know that this year they're trying to open up at least 2, 3 more offices in Maryland. That's a huge deal for Dr. Gupta because like I was saying, like yes, Maryland metropolitan areas is like very competitive. There's a lot of dentists that wants to make it through. That does not mean that you're like, it's very impossible to get a job. But it is like, it is the reality. So I think that like I'm gonna be staying in Maryland, most likely. If there is any opportunity to take over the office, I'm most likely gonna take over the office in Maryland. Dr. Gupta, he actually offered to pay me $1,200 for Pennsylvania license and other documents that's necessary for me to be licensed in Pennsylvania. But then I was like, okay, I'm holding off on that, Dr. Gupta. So he does actually have a lot more opportunity up in Pennsylvania. So if any of you are willing to locate to Pennsylvania, I'll be, looking into that opportunity, because it's not that far from Maryland, like they have amazing offices. Like I Shadow 2, they're very well established, patient flow is constant, like, all of their patients are taken care of. So I think that, whether you decide to stay in Maryland, Pennsylvania, or whatever other states, like there will be opportunities.
Awesome. Thank you, Dr. Shin. Um, let's transition to your current experience a little bit here. This is another awesome question. How is traveling and working at multiple offices? You were floating for a little while. Are there more exciting or confusing factors to it? What is your experience? Like how do you feel about floating and traveling in multiple offices and not having that like one set home office? What if you can kind of give us a little bit insight on that?
So at first I was like confused because I was like, okay, am I gonna have a one location where I'm gonna be able to stay and then build my own patient population? But then I realized that they're like, okay, I've gone through like 4 different offices, and I was like, I actually want to go somewhere else too, because the good thing about my experience floating for first 3 months or so, even though I am kind of like floating up here, I'm gonna be here in Elkton for like next 2, 3 months until my lead doctor comes back. Is that like I learned so much. Like let me tell you, like I worked with so many different doctors in those locations. I saw so many different demographics. Like for Towson area, I realized that patients want more implants. They want to get more definitive cares, like prosthodontic care is more necessary. Down in the rural area, there are a lot of surgical cases. I got to do so many surgical extractions, like wisdom teeth extractions with a doctor who was very comfortable doing surgeries. And then up in the north, like I got to learn how people do bone grafting, like people doing all this, like other extensive work that people need. So for me, I think traveling, the company set my hotel, so I don't have to worry about where I'm gonna sleep that night. I'll ask them nicely, like, hey, can you get me a hotel because I'm gonna be in Salisbury, Berlin, and they will book me a hotel very nearby. And they also pay for my mileage, so I didn't have to worry about my gas fees. Hotels taken care of, gas is taken care of. All I had to do was show up, do what I'm supposed to do, learn from the doctor. The way they do it there is very different. So I picked, I think so far, like what works, what it doesn't work. Like I think working with all these doctors, I learned the best qualities from each office. Like it gives you think about like how am I gonna set my own office? Like this is wonderful from this office. I'm gonna learn from that. This is wonderful from this aspect, like from the office A to C and everything. So for me, I think I became more excited to be able to go to different locations. And there will be days where you're tired because, like, I saw many patients. But like, I'm fairly enjoying it. Like because of this opportunity, I was able to travel so many different locations in Maryland I had never been to. I met so many different people. I got to work with all these people. It's actually for me it's a privilege to be able to do all this work. So that's how I felt. I still feel like that.
Great. Thank you, Dr. Shin. Question to follow up regarding Dr. Gupta. Does he cover your malpractice insurance? What does that look like?
So you don't. I think the only insurance I had to get was disability. So I have my own disability insurance. Everything else comes through with like malpractice or legal issues. Like company will handle that with you. So I didn't have to worry about that aspect much. Like I mean, you can get. I know that I can get AGDs, like American, like I'm sorry, Academy of General Dentistry. They have, like, as a member I can get a liability insurance for free, but I don't have to. I don't have to worry about that aspect. I just have to get a disability insurance myself.
Perfect. Thank you for that, doctor. We have some questions coming in regarding getting in contact with Dr. Gupta. This question's been asked anonymously, so please reach out to me regarding some of the questions you may have, or shadowing a shadowing situation, or whatever you're looking for, whatever you're interested in. Please reach out with getting in contact with Dr. Gupta. I would love to begin the conversation. So we're coming up on the end of the session here. We only have a few minutes remaining. I do want to ask a question that was submitted beforehand. What is it that you enjoy the most about dentistry, Dr. Shin? I would also love to know this. I know the students on the session would love to know it. What do you enjoy the most when you wake up every day in the morning, you go to the office, and you perform dentistry?
Well, I think I don't see this as like common job. Like, I mean, not many people will come to like one office and then completely surrender their mouth to you. You don't get to do this. Like, not everyone get to work on people's teeth, and not everyone gets to diagnose like what's going in their mouth. So I think for me to appreciate that as a privilege rather than the work is what kind of makes me go through each day easier. There will be days where like patients will be very frustrating to you. Like, there is miscommunications will happen. There will be always the patient that will complain no matter what you do. I mean, the thing about it though is that, you are the provider, that you get to work on human body. And then for me, that's the most important thing doing dentistry. And secondly is that I realize I'm more of a restorative dentist. So I like doing reconstructions. So like, dentures, fillings, veneers and crowns and so on. Like I love the fact that I can restore something for them that they lost. Also like we are constantly fighting like, battle against bacterial infections and decays and all that. So it's like, being able to, defy that, and then being able to give that back something they want back. There's no other job like that. So something I would always tell my fellow grads and people in dental school, if you feel tired and you're frustrated, you're going to dental school, like, I've been there. But one thing I will tell you is that end goal is for you to come out the other way, hold your degree high up, and then literally become your own doctor. And then you get to work on people's living tissue. There is no other privilege like that. So just think about it as you become your own dentist.
Awesome answer, Dr. Shin. And I also love that you had kind of two parts to that. You loved about dentistry and you had advice, because we also got a question in beforehand on, like, what's the biggest piece of advice that you'll give dental students, because you once were a dental student before. You've been through it. We've had so many we have so many students on this call. We have from D1s, D2s, D3s, and D4. We have a variety of classes. So it's great that you gave your advice. We do have only 3 minutes remaining in this session. I want to ask one more question of you before we kind of wrap it up a little bit here. So you're currently a couple months removed from graduation, right? You graduated in May 2020. You got licensed a little bit after that. Now we're in February 2021. So being a professional dentist, what does your work-life balance look like? If you can kind of maybe kind of touch upon what your schedule looks like on a weekly basis, and how that transitions to maybe your personal life, and what that work-life balance looks like for you, doctor.
Well, first of all, I don't have any exams to study. I don't have any homeworks to do. I don't have to go into, like, practice for practicals or like whatnot. I do have, outside of my work. So I do not bring work home. So for me, that was important to me, was that I just want to have a job where I can do the work at work, do my notes at work. I do not leave any, like, notes. I know that some dentists will do the notes end of the week or something. I do my daily notes and I finish it up and I take care of my patients and all the prescription I need to send it to for them. And I come home, depends on location. Like, I usually at home by, like, 5 or 6, sometimes 7, it really depends. And then I'm home, I have my cat, I take care of my cat. And then, I also have turtles, I have a lot of fish. So I have all the time for them to, take care of them. I go to gym, like, whenever I am, like, not really tired. After, if I had surgery days, I am very racked and I don't go to gym. If I had a pretty easy days, and I go to gym and I come back, and, like, I'm stress free. Like, that's an important thing I will tell you, is that being a professional dentist, like, yes, do not take anything home. And then that's what I've been doing since day one. And it just makes it worthwhile. I have a free weekend. I can do whatever I want to hang out with people. I can hang out. I have my coffee in the morning. I sleep in. It's amazing. But some days, like, there will be days where, like, you're gonna be like, oh my god, this patient said this to me. Like, I cannot believe. Like, but like, it's easier. And then also, like, it's very different from when you're in dental school, and then you have more choices you can make. It's a good life, let me tell you that.
Awesome. Thank you, Dr. Shin. I think this will be a great way to conclude tonight's AMA. I want to thank you for joining. I know this one was a special one for you, because you are talking in front of the students of Maryland, your alma mater. So I want to thank you again for getting on this, giving your amazing insight. Like I tell you all the time, I love your story. You've come a long way. You work hard. You're currently in a hotel room. So I know I love what you're about and the dentist that you've become. So good luck. Keep striving. I also want to thank the students of Maryland for joining as well. I know that it might be a tough time for some of you guys, just transitioning through, juggling your work and the pandemic and everything that's going on. I also want to thank Arthur Taguchi for helping me set this up and coordinating this as well. So thank you all. Good luck with your dental school, the rest of your dental school semester. Good luck, Dr. Shin. Get some sleep. Make sure you have some water, you have some food. I know that there's a big snowstorm that's about to hit over there. So I want to thank you all for joining, and we'll speak soon. Thank you, everyone.
Bye.